just a quick disclaimer, there's a little like TikTok action in this policy video. If you're not into that, just like get out now, okay? Please stay because there's some good policy stuff, okay?
What's up, guys? It's Madison. Welcome to the April policy meeting. It's a little virtual, obviously, because coronavirus is happening, if you didn't know. But I am not John Proctor. He is officially on rotation, and I am officially captain of the ship. If you didn't know, me and John Proctor worked together in undergrad. And if you didn't know that, you're probably new here. So welcome to the policy video. Before we get into the policy stuff, and there is some good policy things happening this month because of everything going on, here's a little peek into my life at home. I'm a savage. Am I too old for this? Maybe. Nope, forgot. Okay.
I think I'm too old for this. Stay tuned for a policy TikTok at the end because I'm not too old for this. No, not
So I hope you guys enjoyed that little display of talent. Stay tuned, there's another one at the end because one, you probably can't get enough, and two, it just gets better with age. So stay tuned for the end. But welcome to the little 10 minutes of policy. It's 10 minutes of your day. I know that we're not in school. I know that we aren't maybe as focused on what's going on in the world, but we should, because policies are really changing during this time, and it affects you, and it affects future you, and it affects your pharmacist that you're working for in the retail and hospital settings. So this is just my quick recap over the things that I think are important. And we're also going to hear from Hope, who is the previous Vice Chair of Policy, and we're going to introduce our new Vice Chair of Policy. So if you want to see who that is, and I'm pretty excited about it, you should stay till the end. So first of all, this is not related to COVID-19, but it is something that's exciting. TennCare has updated their dispensing fees for pharmacists, so we are actually going to get reimbursed more for the work that we're doing, which is exciting because we are indeed doing work. And so long our fight has been, we're not getting paid for services that we're providing. And thankfully, TennCare and other state laws have helped improve that, and this is just something that is going in that direction. So May 1st, you will see improved dispensing fees for pharmacists, so we will get more reimbursement for that, which is exciting. Back to coronavirus, because what else is there to talk about these days? Drug shortages are a huge problem. I'm sure if you have a job, you've noticed this. Albuterol inhalers are in short supply. Hydroxychloroquine, which was a medicine that they thought might help be like a preventative for COVID or a cure for COVID-19. There hasn't been a lot of data for it, but a lot of physicians preemptively jumped on that train and started prescribing it to their patients. And because of that, there has been a huge shortage of the medication for patients who chronically use it, which is really concerning. I don't know if where you work has put any kind of limitations on this medication, but I know in my workplace, we have banned dispensing the medication to anyone who was not on it previously. And I think Walgreens has done the same. I read that they have a 2-week, you can only get a 2-week fill of the medication at a time, just to try to prevent patients that need it chronically from not being able to get it, which is important. Also, a lot of shortages have been going on with sedatives that are used with ventilators, so like Ativan, Versed. So something to look for if you work at inpatient pharmacy, you might see some of that. Another thing that is kind of interesting, the FDA has lifted their regulations on some of the PPE that we've been using. So normally N95 masks are the gold standard for respiratory precaution in hospitals, but obviously there's been a very high demand of those in all of this that's going on. And so the FDA has allowed us as a country to import K95 masks from China. They are a similar mask, just not what we traditionally have used in the US, but the FDA is hoping that that will kind of give relief to the strains of lack of PPE in hospitals and the strain of the factories that are producing this PPE. So you may see a little bit of a relaxed stress around PPE in your hospital. I'm not sure how that will affect the South necessarily, because we haven't, at least in Tennessee, been a huge hotspot for the COVID-19 pandemic. But I know in a lot of the New York, LA, that has been a huge issue for them. So now, oh, one more thing, I forgot. If you watch the news, you've probably seen that the US has rescinded their financial support of the World Health Organization. Now, outside of politics, this is just something to be aware of because it does affect healthcare in general and globally. And I just wanted to mention it because the American Medical Association has spoken out against this, and we may see the American Pharmacists Association do the same. So something to keep on your radar, to know about, and just to be aware of, and just, to stay informed about healthcare and pharmacy as a whole. So now we're going to take a little trip to Midtown to visit Hope and get an update on how all the policy changes affect students. And then after Hope, we're going to reveal the new vice chair for Knoxville. Stay tuned because it's really exciting. And then you're going to see my TikTok, and we all know that's why you're here. So see you there.
Hi everyone, I hope that you're all staying safe and well in this crazy time, and that you're all practicing social distancing to keep everyone safe by staying home. I hope that we can get back together soon though. I miss having our policy meetings once a month, but I'm glad that we can still communicate through these videos. It's better than nothing. But without further ado, I'll get on to my topic for this video. So I'm talking about licensing changes that have happened as a response to the COVID pandemic. So I specifically looked at this topic because I saw an article in Pharmacy Today in their legislative section about student pharmacists being granted temporary licensure to enter the workforce. And so after looking into it, this is an Indiana executive order that allows student pharmacists who have completed all of their academic coursework to enter the workforce with temporary licenses. So I thought this was pretty interesting, that student pharmacists are one of the professions that are allowed to do this. I also saw that medical students and nursing students are being granted similar opportunities in certain places. By far the most prominent medical professional was the medical students who are being granted temporary or early licensure as a response to the pandemic, which makes sense. And this is even occurring in some states that are kind of close to us. I saw specifically that Mississippi and Texas were two places that medical students could receive temporary licensure after meeting certain requirements to be able to practice to help the workforce right now. And so I did look into what Tennessee has been saying about licensing for pharmacists and other healthcare professionals. And what I found was that obviously Governor Lee has enacted several executive orders, and in Executive Order 14, he specifically allows healthcare professionals who are licensed in other states to be able to practice in Tennessee without a state-specific license. There were a few other temporary changes that he did make to allow for a better healthcare worker response to the pandemic, but that was the main one that I saw. I didn't see anything that was pharmacy or pharmacy student specific in the Tennessee legislation right now. But when I was doing research on this, it kind of led me on a little side topic about early graduation as well. And so it actually turns out that Purdue graduated their 144 students who were eligible for graduation early this year as a response to the pandemic. So in Indiana, apparently there is a pharmacist shortage due to pharmacies having to shut down for sickness or for quarantine. And so Purdue ended up graduating their class early so that they could seek licensure earlier as well to enter the workforce. So while this doesn't affect us at UT, I thought it was a very interesting response to the pandemic and does affect student pharmacists as a whole. And so I wouldn't be surprised if we end up seeing some more changes to this sort of thing, especially as we progress with the pandemic and depending on whether we have a second wave, it's worse, better, etc. So I think this is definitely something to keep your eye on. I thought it was really interesting. I hope that you did as well. And yeah, I hope that everybody is staying safe, everyone's staying well. I hope to see you all very soon.
Thanks, Hope. Great to see you, friend. I miss you. And that was a great little overview about how students are affected by this pandemic. And it's good to know because our graduations could change, rotations are changing. It's really important that you stay informed on the policies that are changing along with it. So now, drum roll, please. I don't know how to make that effect happen, but here is our new vice chair.
Hey, what's up, everybody? It's your boy Balake, aka B Hendo, aka Blake Henderson. Madison wanted me just to make an intro video to let you all know that I'm the new Knoxville Policy Vice-Chair. I'm originally from Maryville, Tennessee, so it's right below Knoxville. I'm excited to get home and be around my fellow students on campus, but I know with everything going on, there's going to be a lot of policy-related changes, and I'm excited to explore and navigate those with you all and kind of get your all's opinions on those subjects. But I hope everybody kills the rest of their semester and stay safe.
Yay, Blake, so nice to see you, and I'm so excited to have you on my team as my hands and feet and just general hype man in Knoxville. So Knoxville, look out for him, he's great. And just to switch gears really quickly before we get to the TikTok action at the end, I want to reiterate and beg you and say, please, please, please contact your legislation during this time. I have linked how to do that in this email. With this pandemic going on, pharmacists have really taken on so many new roles and things that we are capable and able and should already have been doing. So now is a great time to let your representation know that you as a pharmacy student and you as a future pharmacist are a healthcare provider and deserve to be recognized as such. So I hope that all of you will reach out and let them know that, hey, you're here and you're ready and you need to be recognized as a provider. So thanks for listening. I hope you enjoy this little TikTok here at the end, and I will hopefully see you so soon. Hopefully this will just like go away maybe, and I'll be able to see you in the fall. But thanks for listening, and bye.